Does it feel like medicine has failed you? It's all pills and procedures? Have you seen the overreach in healthcare policy and politics? I want to empower you with the knowledge that you need to make your own best decisions. Welcome to the Underdog RN podcast. Knowledge is power, so empower yourself. Welcome back to the Underdog RN podcast. So I want to keep following up with you guys on this transparency in medical billing. I ended up emailing every state senator that I could, my House representative. I've recently emailed Eric Schmidt, Josh Hawley, and Eric Burleson to get something done, like start something in the process of this at the state, federal level, whatever it needs to be. And I think it's going to be more at the federal level than the state level. But if there is anything we can do at the state level, I want to do it. So I've gotten a couple of responses. It's only been during this week. So I'm hoping to get a response from a few other people shortly. I was also referred to Senator Carter, Jill Carter, because she, just reviewing her website, she's a medical freedom advocate, Second Amendment rights advocate, and so I'm really hoping to get something going. Of course, Senator Mike Moon has said that he is willing to work on something with me if I want to, so I'm just going to try to get a team together. I am following up on this. I am, reaching out, and I'm going to keep pushing for this. I think that it's exceptionally important that we start hitting them in their pocketbook, because this is absolutely ridiculous. And as I said in my previous episode, this is not the first time that I've seen this kind of a thing. This is just the first time that I have my own personal evidence that I can use and be public about. HIPAA is like the crown of you can't talk about anything. It makes people feel like they can't talk about anything. And really, you can talk about quite a bit. You just have to be very careful what you say. I can't sit here and tell you about, really specific stories or patient scenarios that you'd be able to obviously identify the person. But that's not the case with these issues. This is widespread. It's everywhere. And it has become so convoluted and so complex and so ridiculous that it's going to take what feels like forever to wrap my mind around it. Even reading this book, which breaks it down and talks about HMOs, PPOs, all these different things in the history of health insurance, it's still it's such a mess. And it all started out with good intentions. In this book, Rigged, How Health Insurance Ruined Healthcare, I think that's the name. They talk about healthcare from back in the, 60s, 70s, 80s, 90s, all the way up to currently. I think it does stop around the Affordable Care Act, or right afterwards. But I'm finding it super educational in how our billing processes work with insurances. And, it's like I said, it started out as a great thing. The problem is it's become so just ridiculous in the book, you refer to them as medocrats, so basically these politicians and people have stepped in and made this such a process that it doesn't serve its purpose anymore. Now it's basically just this giant, billion-dollar industry, and it doesn't really help the consumer. But you're so scared, just like myself, to not have it, that something major or bad will happen, and then you're going to get stuck with tens of thousands of dollars in medical debt, that people buy it. And there for a while it was required, or you were going to be fined. That was the most ridiculous thing. I didn't understand that at all. How are you going to force someone to pay for something and then tell them, well, if you can't afford this, we're going to fine you this? I mean, that just made no sense to me at all. I do understand not having health insurance being an issue, because you do have people that abuse this system. However, it's the same thing as anything else. When you are paying for it out of pocket, you are a lot more conservative, you're a lot more critical, you consider your options, And frankly, I think that some of this has even led to the abuse of the system, right? Like your car insurance. Do you want to use that? Absolutely not. Nobody wants to use their car insurance. You don't want to have a claim on your insurance because your rates are going to go up. Your house insurance. Do you want to use that? Make claims? No, because your rates are going to go up, which makes sense to some degree. However, the problem with medical insurance is everybody has it, or, the majority of people have it, and you want to use it. Well, I'm paying this much out of this, and, what are we getting for it? And then there's all of this preventative, prophylactic care, and it's like you need to go and get all these tests ran. And, my grandma gets a call almost at least weekly. She gets a call, and it's like, you need to go in and get labs done, or you need to go in and have a follow-up for this, or you need to go and do that. And it's from her like Medicare representative. It's absolutely insane. And I'll be with her and her phone will ring. She'll answer and she gets so frustrated, which is completely understandable. They're just calling her all the time. They, poked, prodded, procedures, all of it. And with the billing processes the way that they are, of course they want you to use it, but that's where it doesn't make sense to me, right? You're paying these premiums and your insurance wants you to use it, at least Medicare. Why? Why would you want people to cost the company money? Right? How does that make any sense? It doesn't make any sense to me. You don't see that in other insurances. So what's so different about healthcare in that way? I understand some of it, like screenings and, preventative care, but even our preventative care, frankly, is a joke, right? I went and did yearly physicals for a couple of years, and you go in and you talk about things and they're like, okay, we're going to get this blood work. We're going to do this. We're going to do that. How are you doing, here and there? And you tell them, like realistically tell them, like, I'm stressed out. I'm working full time. I'm going to school full time. I have a child. I'm, really concerned about this or concerned about that, or, and they have no answers. There's no stress management coaching. There's no, how's your sleep? And these are things I've talked about in other issues, but in other episodes. The thing is, why in the world are we not really getting to the core issue of what somebody has going on and then trying to alleviate that or at least provide them some assistance there? With the amount of money that goes into healthcare, I understand we can't solve all the world's problems. And is there really a whole lot your doctor can do about housing prices or, any of that other stuff that's outside the medical? There are some things like case managers and social workers. They have enormous amounts of resources that they pull from to help people once they're in the hospital. We can't discharge somebody back to the street. Okay, so if a homeless person gets admitted to the hospital, you can't just throw them out the front door. That's really not how it works. So if we have that, why are we waiting until these people are so sick or have tons of different things going on? Why are we not, doing better connections with addiction treatments or housing referrals? I mean, just all kinds of things. And this medical billing, insurance runs the whole medical world. Unless you are getting care from an outside provider that doesn't accept insurance or is independent and is kind of working inside the lines of insurance without letting them dictate things, which is fairly challenging, then your healthcare is being ran by your insurance. How ridiculous is that? And this isn't like medical personnel. This isn't your doctor who knows you. I mean, does your doctor even know you anymore? Like my grandma talks about some of the things that her doctor told her, about her kids or things that they referenced or recommendations that they had. I mean, I asked her, I'm like, how did you treat an ear infection? And I think it was warm castor oil. I can't remember exactly what she told me, but yeah, it was like a warmed oil. And why don't we do anything like that anymore? Why don't we look at people's vitamin levels, people's sleep, people's stress management, people's eating habits? Like, why are we, even those of us in the healthcare field, why are we not more educated on it? The only thing I took even coming close to that was one nutrition class in college, and that was about it. And I retained, a good portion of information from there, but nothing like that is truly applicable. And like the diets, the food that we give in the hospital, like a low carb diet, the craziest thing, people can order the craziest things on that. And it's like, this is supposed to be low carb. This is still not healthy. This is still not good for them. So why are we doing this? Why is there no dietitian training, right? Why is there no connection to a dietitian to educate you on truly practical meals in a budget? It's possible to do. It just doesn't make any sense. And it's a lot of it, I feel like, a lot of the issues in healthcare are from health insurance. Prolonging a patient's stay a day or two, or discharging them too early, or not doing a certain procedure because it won't be approved, or not giving a certain medication, or offering these medications because of this. I mean, I don't know like a patient's insurance status, me personally, whenever I care for them as a nurse, and I never really have. I think you could see that information maybe in the ER. There was something that would be on there. I never paid attention to it anyway, but I don't offhand just know what type of insurance someone has. And I can't just easily access that information because I don't need it for my job. But there are team meetings with caseworkers, social workers, physicians, charge nurses, unit managers, sometimes with the therapies. It was something that was always considered. Like, we would have, when I worked inpatient, we would have a huddle at this big board, and the case manager, social worker would come. The nurses were expected to be there around for their patients, the physicians that were for that unit, the charge nurse, and we would talk about length of stay. We would talk about what are the barriers to discharge. And it wasn't totally insurance driven. I don't want to make it seem that way, but that was part of the conversation. And there were things like, well, this patient's, insurance won't cover this or that. And so can we talk to physical therapy? Are they able to do this, or can they do that? Or, just every patient, it was a consideration the majority of the time. And just like I talked about previously with the patient that used the fund to help for their medications, why was the markup from $7 to over $200? $7 to over $200. Why are my son's boots the markup from $250 to over $1,600? This is absolutely ridiculous. Like, we have got to do something about this. So I'm following up with legislators. I want to get something moving. I hope that you'll subscribe to my channels. I'm going to talk about things as they unravel. And I'm going to get as much of this up on my website as I can. And if you want to sign up, put your email in the, there's a 5 things to know when seeking medical care is kind of an article that I wrote about considerations that you should make when you're seeking health care. And that'll put you on a mailing list. And so I'm going to try to put a newsletter together that I start sending out as things develop. So I've started looking at this is where I'm at with it right now. I'm digging into kind of the history so that we can know how we got here. And I've just gotten, especially in this book, I've gotten to a point where it talks about healthcare in the 60s, back when we had major medical or just basically like a hospitalization insurance. If it was preventative care or just your day-to-day care, people were responsible for paying that out of pocket. It was, and back then they would do either cash, sometimes food, favors, trade, something like that. And frankly, I think that's where our healthcare needs to get back to. It needs to get back to a local level, a state level. This socialist federal insurance, Medicare, is just absolutely ridiculous. And you can opt out, but it costs you. It costs you to opt out of Medicare. How ridiculous is that? You are just put on Medicare when you turn 65, whether you want it or not. How does that make any sense? And so I'm going to look into all that too. Why that needs to be taken out, like period. I had multiple people that I spoke with when I worked clinic that, they had to sign like acknowledging a Medicare opt-out. Like we don't bill insurance. We don't communicate with Medicare. All these different, like our providers are opted out of it. Like these are different terms and conditions. And I know some independents do work within Medicare or Medicaid. But what, and they're telling me, well, I don't have a choice. Well, I didn't have a choice. Well, it wasn't up to me. Well, you just get opted in. And that just dumbfounded me because in nursing, we don't talk about insurance. We're not educating on insurance. We are educating on disease process, treatment, and frankly, not any kind of old school treatment. Like, where did all this go? Okay. Humans didn't just all of a sudden, like, everybody died off before we had medications or procedures. Now, I'm not going to say that these are unnecessary because they are absolutely necessary. We save, I'm sure, tons of lives with, colonoscopies and, breast exams and, different things. And medications do work. Like I see it every day when I work. But why are we not focusing more on holistic, functional, whatever you want to call it? Why are we not starting with like the basics? There are tons of plants, vitamin supplements, and different things that work really, really well. I'll just tell you, when I was pregnant, I got, like, when you're pregnant, you have a high risk for UTIs. Your risk for UTIs goes dramatically higher, and it's extremely common. And I had a UTI, and I could not get rid of it. I took multiple rounds, did like 3 rounds of antibiotics, which I absolutely hate that I did that during pregnancy, but what am I going to do? I have an infection. And it finally, the last round, I added this supplement called UT Defense. And I just want to say that everything in this podcast, nobody is paying me for any of this. So I'm not doing any kind of paid advertisements. I'm telling you from real experience. I started this UT Defense through Orthomolecular, and it's amazing. I have not had a UTI since. I don't take it every day. I have like a little regimen that I use for when I take it and when I don't. But I took it every day and I never got a UTI again. And I have recommended this to multiple other women and they have never, like in using it properly, they have never had another UTI. It's phenomenal. And the couple of ingredients, I'll pull them back up sometime for you, but it's absolutely amazing. Just Google it and look at it and then look at the ingredients because it basically just prevents the bacteria from sticking to your urethra. And that's where your UTIs come from. It gets in your urethra, it goes to your bladder, you get a bladder infection, then kidney infection, and it gets worse. It's fantastic. And so I tell a lot of people about this whenever they struggle with it. I think that like older women especially, because they're at an extremely high risk because of not drinking enough water and age and just all kinds of different things. They like UTIs are terrible for older women. They really are. That's where you get confused. The number one sign of a UTI in like a woman over 65 is confusion. They'll come in all crazy, confused, screaming, yelling, just not right. And it's a UTI, and we treat it, and then they're okay. So there are absolutely medications like antibiotics, heart medications and pain medications and different things that are extremely valuable, but that should not be our default. Like, we wouldn't be here today if natural medicine didn't work to at least some degree. So why don't we use that at all anymore? So I'm going to work with these legislators, anybody that I can get on board, and I'm going to work on legislation for the coming session this fall to get something. State, federal level, I don't know. But frankly, I'm sure if we start pushing something like that, the medical lobby is not going to be happy. So any legislator that doesn't support that, because I feel like that's a completely bipartisan issue. Like, that's why. Why would you not want transparent billing? Okay, that's not attacking anybody's rights. That's not imposing anything on anyone. That's not, it's very simple. So there's no reason that you can't get everyone from both sides of the fence to agree, hey, this is a good idea. Everybody wants to bring medical costs down. Or if you want universal health care, don't you want people to know what they're going to have to pay for it? It's pretty cut and dry, frankly. So I'm really hoping to get something off the ground with this. I hope that you'll start talking to your offices, insurance companies, DME companies, and just ask questions, just simple questions. And I want to hear your stories. Feel free to comment any of your stories because I want to hear them. And when I'm working with legislators, I will absolutely use those stories and, can even follow up with you if you have something similar that you've seen or that you've experienced or have going on. Like, even if your insurance is paying for everything, there's nothing wrong with calling the company and asking them, like, what does this cost? And then checking that against your bills or your invoices or explanation of benefits. I think that's something that's one attempt I think that they've made to get some transparency in billing, but that's still not even transparent, and it's exceptionally complicated to read. So we need to do a better job. So that's where I'm at with this, and I'm going to keep you guys updated, even if I have to put little shorts up, or if you follow my Telegram or Twitter, I'll be putting, posts up there. And I hope that, we get something done with this, because it's really important that we start fighting this medical complex that has just become ruled. I hate it when I talk to practitioners and they're like, well, insurance this, that. I don't ever want to hear that response. I'm so tired of that response. That should not be dictating somebody's care. I think that the older system where major medical hospitalization, those are like those group plans, that's reasonable. Everybody's pitching in for an unexpected major injury, loss, something like that. What we have come to now is so extreme and out of control that it's just ridiculous. And it doesn't help you at all. So if you have input, if you have, knowledge in this, if you work in insurance, or if you know someone who does, tag them in this, send this to them, share it with them. I want as much input as possible in regards to this, because I don't know everything and I'm learning it all, and having to do a lot of my own research and reading and learning, and it's so complex. Like, even just asking the DME company, like, how does that even work? And they're talking about codes and contracts, and I'm going to be looking up these codes. And I know that the AMA developed a lot of the coding system that CMS uses and that we have to use in the healthcare industry to bill things. And so CMS pays the AMA for these codes. Like the American Medical Association, I also looked up their lobbying, and they have spent the most of any healthcare organization, including the National Council of Medical Boards, than anybody else. Like, the AMA is way over the top in lobbying and healthcare, and of course they are, if they're writing the billing code system or came up with the billing code system through them and then are partnering with getting paid from CMS and partnering with them, like why wouldn't they want it to keep being like this? And then they develop, point whatever of this code, of this code, of this code, of this code. And it's just ridiculous how it has grown and the amount of over coding, over processing. I have a coder I'm going to reach out to and start talking to as well. She's been doing this for a long time because it's ridiculous. And what they're using this coding system for is even worse. Like they're tracking your vaccination status. They're tracking, your healthcare and the things that you have going on, or, if you get labeled pain seeking somewhere else, that's on there. And all of this information is shared between companies. Like we have way too much crisscross going on between healthcare organizations like the AMA, CMS, the FDA, the CDC. I'm going to be pulling up some of their profiles and reviewing that with you guys. Like you can look at their LinkedIn profiles, some of the board members from CDC and FDA, and they've previously served on Pfizer, or if you look at those board members, they've worked at the FDA or CDC. Like there's just a lot of crossing over between those industries. And that obviously is not that's not how it should be ethically. So I hope that you found something useful here. If you're interested in this, or, you want to help in this fight, reach out to me, but please comment your stories. I want to use that when we go to do legislation. That's going to be, I can put up a testimony. There's a testimony process for bills, and I'm really hoping that we can get something done, at least at the state level, but federal level would be wonderful. So I hope you guys are doing well. And if you have any questions, don't be afraid to reach out. But otherwise, I will catch you next time. Thank you for tuning in today. I hope that you found some of the information insightful and helps you advocate for your own care or someone else's. I want to encourage you to follow me on Twitter, Rumble, YouTube, Telegram. You can also find me at my website, underdogrn.com. Knowledge is power, so empower yourself. And let's make it make sense.